Hello and welcome to the Care and View, the online social care chat show going out every Tuesday on YouTube and on Catch Up and also on all major podcasting sites. Before we get started, don't forget to hit that subscribe button, tap that bell so you're updated with all of our videos, follow us on Facebook, Twitter and LinkedIn, and all the views we express tonight are of our own and not the companies we represent. Please do not use the comments tonight if you want to ask us a question to answer in the show. We are not live. This is a pre-record, but please use the comments to give us your feedback. We will be checking on them and we will be catching up on them at some point. Hello, Mark. How are you on this non-Tuesday?
Yes, not too bad. Thank you very much. How are you?
I'm good. Thank you very much. I'm good. We've had a busy couple of days, haven't we? I mean, we've had a busy couple of days for a multitude of reasons. So let's do the news first, because I think things have been going off in the UK right about now. So what's new in the world of social care news?
What is new in the social care news? Well, prior to all the political changes happening, the government released a consultation around the Care Quality Commission. So they're looking at whether the three regulations, the CQC regulations, the Review and Performance Assessments, and the Health and Social Care Act, whether they are appropriate and proportionate, and whether any changes are required. So yeah, I think that's going to lead to an interesting kind of conversation. It's only open for a couple of weeks, so it closes, I believe, 2 weeks' time to the 22nd. So it's only open for a very short period of time, but I think it's going to lead to some interesting kind of things coming up and conversations happening. Obviously, we know that the regulator isn't fit for purpose, so it'll be interesting to see whether people put that into this consultation or not.
But it's not been madly advertised, has it? We happened upon it on LinkedIn. It's not like the government's gone, oh, we know you don't think CQC is fit for purpose, so here's a consultation to tell us. It was kind of like 2 weeks, and then you can have your say on the regulator, and then it'll be done, and we'll just put something out. So I am hoping there'll be plenty of people getting to be able to do this. Maybe we'll actually put the link in the description to this video as well, so people will be able to follow that through. So we've got that consultation running. We've got some new IPC guidance. Now, I will admit, I've not managed to read through it yet because that did come out a day before our government decided to crumble around us. So what's new in the IPC world? Is it any better for care home visitors yet?
Visitors, it has got better. So they're acknowledging that people can have endless amounts of visitors, but it's still one at a time. There are some positive steps to it. But still so much further that needs to be gone before, people can just have their lives back and see their loved ones in care homes, and also for the residents, just to be able to have their friends and family come back and visit.
Yeah, so if you are watching this on Catch Up, which we obviously hope you are doing, please do get in touch with us. Pop us and mention in the comments, how are you finding visiting at the moment? Is it getting better for you in care homes? Are you still getting locked out? Are you still unable to go and visit freely? Are you concerned that the sudden rise in cases around the UK is going to prevent you visiting in the near future? Are you afraid of the return of draconian sort of lockdown rules? Do let us know. We'll probably arrange a show around it. We can start having some conversations with people and we can try and bring some answers to you. So please do let us know about that. So Mark, I'm tired. Are you tired? We've had a busy 2 days at the UK Care Week show in Birmingham, haven't we?
We have, yeah. I don't know. I left on yesterday, Thursday, and I felt like it was a Friday afternoon. And then obviously having to wake up to the alarm and go to work this morning, it was a heavy slog, but yeah, here we go. But I think you've been busier than I have. So yeah, how was it? Obviously you had the big interview with Ed Balls.
Oh, Ed Balls. No, it was good. It was good. Day one was good. I mean, it was a little haphazard. There was a bit of a change to the panel day one, but we managed to do it. It's a good keynote. Hashtag sexify social care. We had people screaming that out in the crowd. So if you are watching this, hashtag sexify social care. I'm not meaning X-rated. I mean, let's make social care attractive. Let's make social care, enticing. Let's get people into the sector. And obviously we had the people plan session, which always goes down really well because the report of itself. But day two was the day for me, Ed Balls, having him on stage whilst Boris Johnson's quitting, 59 MPs had resigned. There was no one in the Department of Education that was a minister. Our government had kind of just gone, yeah, we're just going to switch it off and turn it back on again and see if it works. So that was really interesting. I did a really good dynamic with Ed, and I think what was wonderful was being able to have that sort of honest conversation. So for those who don't know, we obviously did a documentary, Inside the Care Crisis. And he's become quite a prominent face for social care now. And he was quite open about it, wasn't he? He was like, I am not the face of social care. It's the people in social care who are the face. But I think what we do need to realize, and I did say this to him, is everyone has relatives. Everyone has an experience of care. So just because you're a celebrity or an ex-MP or, you know, a bad dancer that was on Strictly Come Dancing doesn't mean that you can't be seen as an expert in care on your own personal experience. And I think we need to stop safeguarding who can have a say on social care and who can't. I think we need to start acknowledging the human experience behind it and the human response. But I mean, I was on the stage talking. How do you think it went?
Yeah, no, before I answer that question, I think you're absolutely right. I think the thing is, we have the people that are on the media and they're talking about social care, and we've got you and I doing this, and we've got people like Sophie Chester-Glynn with her podcast and bits and pieces, but nothing's actually changing. Like, the government aren't listening. So if we've got somebody, whether that's Ed Balls or that's somebody from, you know, Love Island or from East End or wherever they're from, if they're ramping up the, you know, the awareness of social care, surely that's a positive thing, you know, getting it in the media, getting it spoken about, you know. And actually, I don't see it as a negative, regardless of who it is. And like you said, we don't know what everybody's background is, so why should we be judging? I think with regards to the actual interview with Ed, I thought it went really well. I think it was, you asked the questions that the people wanted to know the answers to, and I think he came across very genuine and honest in his answers. And I think, you know, I think there was only one thing I disagreed with, which was where you'd asked him about when you should start the education around social care in schools. And he didn't agree with that. He thought that it should be later on, which I personally don't agree with. But other than that, I thought that it was a really good presentation. And well, it was a bit longer than 30 minutes, but the slot just flew by.
And it was such a shame. It was packed, absolutely packed. And I'm not saying that we pulled the same crowd later on, but we also had our second ever in-person Care in View episode from there, didn't we? And that was so good. It was so good. So it was a mixture of two episodes we'd done before. We had Anushka Farooq join us, and we had Martin Dawes join us, both who had been on our wellbeing episodes a couple of weeks ago. And that was great. I mean, audience interaction. You know me, I cried on stage. I'm not going to apologize for it. I'm an emotional beast. That's what I am. That's who I am. But it was good, wasn't it? And you did the chairing this week, which was wonderful. It's just so great to be on the road doing the show.
Yeah, no, absolutely. And I think, like I said to you after, we had so many people come up to us afterwards and they said, oh, you've got some really valuable tools that we can actually take away, and people messaging us on Twitter and LinkedIn. And I think that's why we started the show, you know, over a year ago, was that actually it was easy wins that people could put into their services. And it was great, actually, that people could take that away. And obviously, well-being is such an important thing right now. And actually, if we can give people tools to go away, simple things like just making sure you take your lunch break, you know, all of us should be doing it. All of us don't do it, but that is something we could easily implement.
Yeah, no, I totally agree. So, I mean, this is probably the meatiest bit of news section we've done in a long time. So don't forget to subscribe to the show. We are going to bring in our guest now. The Care in View is powered by carestockroom.com. Please do go and check them out. So before we bring in our guest tonight, we are discussing social care across the seas. We are going to our friend across the pond. We had a privilege of joining Lance on the All Home Care Matters podcast earlier on this year, and we're delighted for Lance to be able to join us tonight as well. So, good evening, Lance. How are you?
Wonderful. Thank you, Adam. Mark, it's good to see you guys again. Thank you for the opportunity.
Good evening. Thank you very much.
How are things over in America? What's the weather like?
Weather's beautiful. It's just about 10:30 in the morning here, so I'm kind of getting my day started as you're probably winding yours up. But so far, it's a beautiful day.
And whereabouts in America are you, Lance?
We're in Michigan.
I used to think Torquay was in Japan, so you're going to have to tell me where
Okay.
Michigan is.
I know Michigan. My aunt used to teach at Michigan University, so yeah.
Okay, well, that's a good choice. University of Michigan is the only university we recognize in the state, so that's wonderful. But yeah, so we're about 10, 12 hours west of New York's. We're considered. Okay, so we're considered the Midwest, even though we slant a little more to the east than we really are in the traditional Midwest. But Michigan's considered part of the Midwest. We're the state that looks like a hand.
So, just for our viewers, Lance, who probably don't know you, because we are still learning everything we know about social care in the UK. So,
Yeah.
to know stuff from America is a tall ask for people. Who are you? What do you do? What's your podcast? And what's your experience of social care?
Absolutely. So, our family owns a home care company here in Michigan. We're proud to always share that we're the #1 rated company in the state for going on 4 years now. And as a result of that, we did a lot of community work, a lot of community education. And when the pandemic started approaching back in early 2020, we started noticing a lot of our community work that we would do, and we call it community give back, was starting to shut down. Your senior centers, churches, community centers, and things like that. And our workers were considered essential, so they're continuing to work, and we're on the front lines of helping these people stay in their homes, stay safe. And we wanted to still have that give back aspect to our company, so we started a podcast called All Home Care Matters. It just hit 2 years old in May of this year, so we started it in May of 2020. And we've had wonderful guests on from all different professions, and you gentlemen coming on to share your experiences in the UK. And we just have found that, there's such a need for it, as I'm sure you found with the Caring View. And we're just trying to give back and, help people who may not have as big of a voice or as many resources as other people may have, and just try to help them through whatever it is they may be facing when it comes to long-term care issues, whether it's age-related issues or, you know, disabilities or handicaps or illnesses, and have experts on from various professions to share these tips and resources with them.
So, you do home care, and in our country, primarily we know it as domiciliary care. We do know it as community care. What's the home care model like in America? So for us, we are either commissioned by a local authority, a local government, and we are commissioned by our health service, the NHS, or we're privately commissioned by the individuals themselves. And we
Right.
go out, we deliver our care. We've got a regulator that oversees our delivery of care, be that the CQC, the Care Inspectorate in Scotland, or our other, representative devolved states. So what's it like in America?
Sure. So there's several different ways of answering this. So first and foremost, we have home health care, which is professional skilled care. This falls under skilled care, which you can get a prescription for from your physician, and you will have a registered nurse, social worker, occupational therapy, physical therapy, speech therapy come to your home if you're following the Medicare guidelines. We are under the home care side, which is considered non-skilled, but we can all agree there's a lot of skill involved, but that's more for billing purposes and regulatory purposes. Then when you get into the home care side, the confusing thing for many families is they think home care are the same thing, and they're complete opposites of each other. They can complement one another, they can support one another, or they can work independently of one another. And the home care side is more privately sought after by the patient or the client or the family, where they would hire us directly to come into their home, their group home, nursing home, even hospital, to stay with their loved one. The unfortunate part of that, though, is in the United States, there is only about half of the country regulates the home care side. So, with us being in Michigan right now, unfortunately, it's a non licensed state. So, what that means for families is anyone could call themselves a home care company. And that's not necessarily a good thing because there's nobody overseeing or regulating that they're operating as the way they should. So our company functions as a fully licensed, regulated entity as much as we're able to with the resources given, since our state is considered a non-licensed state. And then families say, this is when we need help, or this is how much help we need, this is what we need help with. But we do everything below requiring either a licensed practical nurse or a registered nurse. So it's all the support services, your activities of daily living, the hygiene care, personal care, dietary needs, memory care, as well as helping with medications, and just being a companion and being an advocate for that person. Something we spoke about when you guys were with us on the show during the COVID pandemic, when you had the restrictions in place where families couldn't go into the care homes, they couldn't go into the hospital. It was a benefit and a blessing for the families we were helping because they couldn't go see their loved ones, yet we were able to because we were deemed and classified as essential workers. So we would really be the advocates and the eyes and the ears for that family's loved one throughout the, the pandemic and all of the restrictions until those were lifted. And there's still a lot of restrictions in place, and a lot of hospitals now are basing their visitations on a as needed basis based on what the COVID numbers are for that week or that month or whatever they're advising for. So there's still a lot of stuff that we're kind of maneuvering through, but the home care workers, care home workers, they are so essential to these families, and I think even more so they're getting the recognition that they so deservingly are entitled to.
Yeah, no, absolutely. And I think one thing Adam and I definitely, beat the drum about is, about the recognition that the frontline staff truly deserve. I know we spoke about the regulation and you touched on it there. Has anything shifted? So last time, obviously, and you've spoken about it today, obviously you've got some of the states that are and some aren't. And here in the UK, we kind of, even though we're regulated, what we're seeing is a lot of the social care providers are actually picking up more of the health tasks. So they're doing blood pressure monitoring, taking temperatures, doing a lot more kind of things that district nurses would have done historically. But obviously the recognition still isn't there. They're still not seen as skilled. Are you getting any closer to being regulated, do you feel?
I don't feel like we are, at least not where it should be, Mark. I know recently Cornell University here in New York, it's an Ivy League school. So it's up there with your Harvards, Yales, Princetons, Oxford for our UK friends. And they are actually doing a whole study and push right now, and they are seeking to elevate the appreciation and the recognition that home care workers should be getting, and they're duly entitled to. And I was really excited to see that article just came out a couple weeks ago, that here you have a prestigious Ivy League school that is now focusing a whole research around promoting the importance of home care workers. And I think that is one of the benefits, if there are any, that came out of the pandemic, where they're getting, the industry as a whole, I think, is getting more attention, and maybe people are starting to take a little more notice. But I do feel like there's still a tremendous way to go before it actually gets to the level that it should be at.
And I want to touch on recruitment. So recruitment over here in social care is hit or miss. It's either really good for providers or it's just diabolical. What is recruitment over there? Obviously, it's still seen as a low skill, a bit like over here.
I think it's still in that, kind of bottom of the totem pole, because just like, we spoke about previously, during the pandemic, everybody's wanting to call frontline workers heroes, and, they're wonderful. But as soon as it was almost like things started to go back to normal, that was quickly forgotten about, right? And all of a sudden, the heroes that were yesterday are now zeros today. And I think that reflects really poorly and negatively on the industry and the workers as a whole. Because if one day you're calling me your hero, and then now all of a sudden, you don't really care about me anymore and I'm not significant, what is it? What kind of message does that send? And if I'm somebody actively seeking employment and I'm noticing this, I'm going to give it a second thought before I would want to enter into something where I'm not even going to be appreciated, or I'm going to be appreciated when you need me, but when you don't need me, you no longer appreciate me. It should just be appreciation from start to finish. Because like, we told our staff and families, we weren't doing anything extraordinary during the pandemic. We were doing what we've always done. So, I mean, yes, there was a lot of, kind of uh, sort of, going with the flow, because you didn't know what was going to happen from day to day with restrictions and different things. But, as far as like PPEs, people upset that they have to wear a mask, or they have to wear gloves, or they have to wash their hands after contact. We were doing those things before a pandemic. I mean, that just was kind of standard, right, for what we do as a whole day to day. So there wasn't much of an adjustment there. What the big adjustment was is, when you have we call them clients. When you have a client, and every Friday you would take that client to their favorite restaurant and take them to a movie, or take them to get their hair done or nails done, and then all of a sudden you're telling them, no, we can't do that, right? And if they have some sort of cognitive decline or cognitive issue that they're dealing with, that becomes a more difficult challenge to be able to try to explain the reason why, instead of being upset with us saying, well, why won't you take me? You always take me. Are you mad at me? Or, you got to explain, well, no, this is what's going on. So that adds another level that you have to deal with day to day with trying to, calm those fears and those anxieties. And then you have people that you may only see 2 or 3 times a week, not full time or regularly. Now they're completely isolated, where the daughter might come after work and visit her mom on Tuesdays and Thursdays, isn't able to come and visit her now on Tuesday and Thursday. So now she's only seeing us on Monday, Wednesday, Friday. And for people with, cognitive, emotional issues, and even those that don't, that isolation's been shown to have increased depression, anxiety, and all sorts of, negative effects on people that are already dealing with enough to begin with.
Absolutely. And I think one thing we're seeing is that, obviously I spend a lot of time working with people with learning disabilities, is actually we'd spent so many years upskilling them and giving them the confidence to do things that then they were restricted for 2 years. Now they've gone back to probably worse than they were in the beginning. But one thing, just talking about recruitment. So here we have this big thing about the pay of our care workers and what we should pay. And we've got supermarkets that pay more than the frontline staff here. And we've got Amazon and McDonald's that pay, more. What is the pay like for care workers over there?
Sure. So interestingly, in most fields, we've probably all heard about the gender pay gap and, disparaging, wages and comparisons to men and versus women. But in the United States, at least, home care workers, women actually make more on average than the men do. Now, it's not significant. For every dollar that a man makes in the home health care industry, a woman makes a dollar and a penny. Now, it's not significant, but I think it's crucial to look at that in the sense that if it was reversed, then people would be saying, see, there's another pay gap between men and women. But here you have a situation where it's actually women on average make more than men do, which I find interesting. Um, as far as the average pay rate, it really truly depends on what position you're going into. So, you have a higher skilled caregiver, care worker who might be a licensed CNA, for instance, a certified nursing assistant that requires, state licensing and, renewal of license and continuing education. They're going to make on average $1 to $2 more than somebody who may be a home health aide and a person who may have just had tremendous life experience caring for a spouse or a child or a parent. So the wages vary, but they have gone up since the pandemic because nationwide here in the United States, and I'm not sure for the UK, everybody's hiring. There's such a shortage of employment positions that are filled. Even though you get reports, and there was a report that just came out today, as a matter of fact, that said, for June, our employment numbers went through the roof for new jobs, for new hires, for new people entering the workforce. But when you drive around and you talk to other businesses and you see signs, it doesn't reflect that. So we feel and we see that there's still a tremendous shortage, especially in our industry, where we're constantly looking to add more vital people because we cover a large part of the state. So we're covering a large territory. We need a large amount of staff, and we have constantly families. And I think this is a result of the pandemic also, where their loved one may have been in a group home or they may have been in a nursing home. In the nursing home, they didn't necessarily have to be in the nursing home. In the United States, to be in a nursing home, you really means you need a registered nurse on call, on standby, available 24 hours a day, 7 days a week. Otherwise, you could be in your home or in a group home or a care home if you don't require that skilled medical care, IVs or intensive wound care and management. And a lot of people don't realize that. Home care is still overall, when you look at healthcare, a very unknown entity for the most part for the average person. And I think that with the pandemic, I think with the visitation restrictions and all of the other things that played into it, I think people discovered there's other options out there, whether it be a group home or a care home or home care. And so we've seen a quite a significant increase in families needing and wanting care by home care being the provider rather than having their loved one in a facility. And truthfully, I think overall that's a healthier, better place for a person to thrive at being in those familiar surroundings. You may still not feel good, but I think it does help overall your mood, your healing process, and just your ability to thrive when you're waking up in your own bed in your own home rather than waking up in a strange room and in a strange bed.
I think that's something we're seeing mirrored over here in England and around the UK. And, you know, we've had recent surveys and data done where actually the demand for care homes is dropping off. There's less people looking into care homes as an option for long-term care. You know, home care is that option, but even the demand for home care now is starting to dwindle. And we're actually looking and seeing more hybridized models of care delivery. So we are looking at things like the community providing and families providing and jigsaw piecing together a package of care which meets their needs from various angles. So in America, what are the debates? What are your discussions around the future of social care? You know, do you think your care homes, nursing homes are going to last the next 10 years, or do you see the landscape of care changing drastically?
I think yes, I see the landscape changing drastically, and I think we're already seeing that. I don't think nursing homes will go anywhere because people still need that long-term medical option if they're not able to be in a care home, group home, or have home care. But I do see a drastic change in the landscape because we have the baby boomer generation, and every day, I forget what the statistic is off the top of my head, but it's something like every minute or every hour of every day, somebody in the United States is turning 65 years old. And our numbers are going to just balloon out of proportion over the next 20, 30 years. And that's all coming from, the World War II generation. These, men and women that went and served during World War II. We had the GI Bill and all these wonderful benefits that the government put in place for these military men and women upon returning home, and they had large families. Well, those large families that they have now grown up, and now they're entering into their senior years. So, back in the 50s, 40s, you would have a family of 5, 6, or 9 or 10 kids. Nowadays, the average family has, I think it's 2 children per family. Some more, but as a general average rule. And so now they're all aging into the age of gonna need care. And one of the things that I've always spoke about with the pandemic, if you were following any of the news here in the States, we were building temporary hospital tents and, bringing in, we actually brought in one of our Navy Red Cross battleships and stationed that in the port in New York for COVID patients. Our infrastructure wasn't built to support the baby boomers when they decided, when they eventually grew into, their middle age and senior years. And there's not going to be support for it. On almost every other corner here, we're having, assisted living facilities built from the ground up because there's going to be such a need and an influx in the coming years that we have to have that infrastructure in place to support it. And hopefully part of that will, sorry, Adam.
No, I was going to say, so unfortunately, the news over here during the pandemic wasn't really much, this is how you're coping with it. It was Boris Johnson. So Mark and I have been joking about how Boris is a mini Trump, and now I've got it in my head that he is Trump. Most of our news was Trump wants to inject himself with UV light and drink bleach to get rid of COVID. So that's the majority of our news, because Donald Trump was a source of entertainment for us for a 4-year period. I know he was, a dark cloud over America. I just want to touch on this baby boomer thing, though. So, not to spark a debate on pro-life choices and things like that, but is there a concern now, then, with the recent overturn of Roe v. Wade, that if you're saying now that you're not able to meet the demand or meet the baby boomers of now, of these aging generations, if this abortion situation is what it is now in America, is this not going to be a problem further on in the future as well? Is your social care capacity not going to drastically increase? Because yes, we know we've got contraception and we've got prophylactics, but things happen. And if people aren't able to make that choice about whether to have a child or not, will your demand for social care and healthcare not just exponentially increase?
I think it will. I don't see how it would not. Now, one thing, because I don't study that part too much, so I can't speak too intelligently about it. But one thing, I want to kind of clarify. So the Roe v. Wade did get overturned by the Supreme Court last week, and but what they did when they overturned it, they gave the decision back to each state. So if you're in a state that is pro-choice for their government, they'll still allow for uh, women and for families to choose an abortion if they decide to. And if you're not in a pro-choice state, you're then that state most likely will then ban abortions. So it's not that abortions are outlawed or taken away entirely. It's just given back to the state. So instead of our federal government making the decision, they're letting each state make their own decision. Um, which probably, yes, it will create a greater need for more social care. I just don't it's a little more out of my comfort zone to really know how that will affect it. So I don't really have a lot of good information on it. But that's basically what they ruled is it's just going to be up to each state to make their own decision on how they want to handle it.
And couple of questions, and one you might not be able to answer. Do you think you'll see a lot of people move states and around?
I think yeah, I don't know, Mark. I kind of equate it to elections. There's always those people that say, well, I'm going to move to Canada or I'm moving to Zimbabwe or, whatever they choose if this person gets elected. But then, that person gets elected and they're still here, So I think a lot of it might be an immediate emotional response, not necessarily a thought out intelligent response. It's more out of emotion than out of thought. So I don't know. I mean, I don't know the answer to that. It'll be interesting to see. But again, you know, I think that's just a decision that people will have to really make that they think's best for them. I, you know,
Oh, you're still there. Sorry, it froze slightly, so I didn't know it was my camera or yours, but yeah, no. And then what was the second question I had? Oh yeah, the second question I had is obviously when we spoke to you before and listening to you tonight or this afternoon, there's so many similarities between social care here and across the pond in America. And one thing we've had guests on to talk about children's services here, and the similarities in our adult social care are very similar in childcare. So no recognition, low pay, recruitment's diabolical, the services aren't fit for purpose. Are you the same in America with regards to children's services? And obviously I know you don't operate in them, but
yeah, I don't really know children's services too well. We do take care of children who were born with a number of different issues. Um, and I know one of the issues that, families do share with us is there's not the support. Again, when you're hiring home care, you're either paying for that with your own money out of your own pocket, or there's veteran benefits called aid and attendance, but then you have to meet a financial requirement for it, which most veterans for the most part have all had successful good jobs and careers and retirements, so that eliminates them from being able to get that benefit, which I think it's unfortunate. I think if you served and you're honorably discharged and you volunteered yourself to defend the country, whether you went to war or didn't go to war. That's the other requirement for this benefit, aid and attendance. You had to serve during a recognized war. I think you should get that support if you get into your middle, late ages or whatever the need is, and you want to stay in the home that you worked your life to pay for and provide for. I think that should be something automatic. I don't think you should have to meet a financial requirement, but that might just be wishful thinking. Because I also think that our Medicare system should pay for home care, not just home health care as well.
I want to touch on, as you can probably tell, I'm quite politically minded at times. So I want to touch on the political angle of things. So in the UK, we have our Health and Social Care Secretary of State. We also have a Minister for Care and Mental Health, and they do interchange. We've had three Secretary of States for Health and Social Care over the last sort of 24 months, and we've had two Ministers for Care and Mental Health. And these are the people who will run our Department of Health and Social Care, make these big decisions around social care and healthcare, and really come up with the legislation and regulations that we all need to follow. What is the sort of political landscape of care in the USA? Is it on par with the health system over there, or like in the UK, is there a disparity? Because if you ask someone in social care in England whether they are on the same sort of podium as the NHS, they will go, no, we are the poorer cousin. We are less thought about. We are an afterthought. Is that the same in the US?
I believe so. So we have several different resources that families can call on looking for help. We have the Area on Aging, which is a state county service and resource, and they can offer some support for families. It's very minimal. If you need help 24 hours a day, 7 days a week in your home, there is no such benefit that the government will provide to take care of that for you. However, I do know that President Biden has been making a push to get, our direct care workers and long-term care services some more resources to be exercised for. But it's still got a long ways to go. I know we have some community living services resources. It's called CLS, and they will allow families a certain amount of money to hire somebody directly, not a company, but hire somebody directly to take care of their usually it's a special needs child up to a certain age. And we get calls frequently because they're not able to find a person through that resource. So but yet they can't use the money to hire a company, which seems a little, you know contrary to me. If you're going to provide them the resources to pay for somebody individually, you should be able to then use that money, if you can't find somebody that route, to hire a company to do it. And there are certain requirements and things that those individuals have to go through if they're going to be an employee under that umbrella. But a company could just as easily provide that training for their staff, and then meet the regulations to then provide that care if the family's not able to find that resource. And most families who are using that resource, they're not going to be able to pay for a company out of their own pocket. It's extremely expensive. It's very, very, what's the word I should use? It's very difficult if you're a family taking care of a special needs child and you're trying to work full time. And unless you're very well off or have an extremely well paying job, you can't necessarily pay to hire a company that's going to charge you 25 to $35 an hour to take care of somebody that one of your loved ones. Um, so I mean, there are some resources. It's very limited. I know here in our state, if you were in an auto accident, right, your insurance, you have personal injury insurance, and all these coverages on your auto insurance. And just I think it was a year or two ago, there's a new law passed where now the insurance companies, instead of paying the 100% of whatever your payout was for your injury on your coverage, they cut that by about 60%. So a lot of companies, this has been in the news quite regularly, because we have a famous hockey player here in Michigan who, won the Stanley Cup. Oh gosh, 25 years ago now, I guess. And he was paralyzed because his limo driver, I believe, was drunk, or there was something involved there where, it wasn't a good situation. And so as a result of the accident, this hockey player just won the Stanley Cup, a key player on the team, great player, gets paralyzed. And so the auto insurance for the last, 25 plus years has been paying for the company to come in to take care of him. Well, the company just was on the news the other day, and and I understand this. They said we can't keep going. We are not able to take care of him, but yet lose money while doing it. you know and it's not a money thing. This is a business thing, unfortunately. They have to pay the staff. They have insurances, taxes, and all the other components that come with having a company. And they said, we're losing money, and he's not the only person that we're caring for that was a result of an auto accident. They had, I think they said 20 some people maybe that they were taking care of. And it was coming to a point where they were going to have to discontinue the care, and now you have these people who are going to have no care. And it's not like they can just go get another company, because another company probably would say, unfortunately, we're not accepting auto accident cases right now because the pay, we can't cover the cost. We can't operate at a negative. You're not going to, you know, hire somebody, Adam, to do work for you and, pay them $25 an hour, but the person that is paying you for the work is going to give you 20 an hour. Well, you're losing $5 an hour every time he works, and that's the unfortunate part. That's something that I believe needs to be fixed, and fixed quickly, because there's a lot of people that need care as a result of an auto accident, and that was their saving grace, is having that benefit in their coverage, where if they ever did need care as a result of an auto accident, I know I'll at least have the care I need because my insurance is going to take care of it. And now that resource isn't entirely taken away, but it's been significantly changed and altered to where it will be very difficult to find somebody that can provide it at such a reduced margin.
So I just want to touch on the workforce angle again, and I was trying to figure out in my head when you were talking about $25-30 an hour. That's around $25 is around, I think, £21 over in the UK. So we have what's called the national living wage over here. So we have a national minimum wage and we have a national living wage. The national minimum wage is split up into different age brackets, and the national living wage, ideally, I used to, as a provider, would give it to everyone, no matter what their age group was, because if you're doing the same job, everyone should get the same amount of money, in my opinion. So our national living wage is £9.50 an hour or something like that. So is there something similar in America where actually employers need to pay a person a minimum amount of money, and what is it?
Yeah. So our national living wage in the United States is $16.54 an hour. That's the national living wage. The minimum wage, which is separate, that's on a state by state basis. So in our state of Michigan, our minimum wage that employers must pay an employee is $9.87 an hour. Now, I know I can only speak for our company. We pay significantly higher than the state minimum wage, because let's be honest, you can't live or survive on $9.87 an hour. And, when I think of minimum wage, I'm thinking more of, somebody getting their first job while they're going to high school, or, just making a part-time job just for a little spending money. They're still living at home with their parents. They don't have rent, a mortgage, car insurance, all that. And, that's just to teach them more of a responsibility and, work ethic, to show them, look, do you want to better yourself, or do you want to do this for your life? So in Michigan, that's our minimum wage. But like I said, I don't know of employers off the top of my head that pay minimum wage, especially now. I mean, you even go by our fast food restaurants and they're saying, start at 12, start at 13 an hour. I do know we recently had someone in our offices who was interviewing, and she was a retired nurse, and she was just looking for something to do part time. And she had shared with us, she said, yeah, I went just to kind of, get back in the groove of things. I went for an interview at a local fast food restaurant. She said, I thought, maybe just a couple days a week. And she didn't really, once she did the interview, she thought, no, that's not what I want to do. And she said, but the thing that really kind of bothered me about it was their sign said $14 an hour. But when they offered her the job, they offered it at $11 an hour. And she said, but your sign says 14. They said, well, no, go look at the sign closer. And so you have big 14 in large, large letters. And right at the bottom, it says up to $14 an hour. So it was a little, bait and switch. I consider that, and so she said that turned her off. And she said she'd rather be helping people than serving people food. So she, that's why she applied for work with us. But she just said, that really bothered me. So now when I see these signs, a lot of them do say, up to or possibly, or, one of the pizza places earn $25 an hour. I'm thinking, wow, maybe I need to change jobs. Well, it said $25 an hour with tips. So, it's all in how you market it and how you advertise it. But yeah.
I think we have that over here as well, though. Providers will say up to, and it's actually their bank holiday rate. So it's only how many bank holidays you get in a year. So it's not the whole time. I think, yeah, we're probably the same as you. We've got a lot of providers that are paying above the minimum wage. And then we have people calling, for more. I was just doing some Googling. So our supermarkets over here, one just down the road from me, starting price is like £15.20. So in dollars, that's $18.29. Whereas kind of the higher end of social care, kind of in my company, we're paying £13.80, which is $16.60. So there's still a huge kind of gap. And we're kind of one of the only providers paying kind of that rate. But one thing I was keen to talk to you about was around the digital side in America. So over here in England, we've currently, when this report came out, which was last month, 45% of care providers were on digital platforms for care records and bits and pieces. The plan from the government is that they want 80% by 2 years' time, March 2024. What's it like over in America? Are you digitalized, or is some of you digitalized and some of you not? Or
yeah, so I know the hospitals all went to electronic records, and they're trying to get a lot better and more efficient at sharing. A lot of that is for medications, and also they want to prevent drug seekers from just hospital shopping, going to several different hospitals at once to get different prescriptions for opioids. With us, we do paper and digital. We do, it's a wonderful system where, our offices get all of the records in real time, but then we also do keep a paper record as well. So I do see a great increase in everything becoming digitalized because, again, we have a paper record as a backup also because we all know technology is not flawless and technology can sometimes have its issues. And so it's just kind of a security blanket, if you will, a safety net to have a backup. But yeah, so that's how our staff operates. They will, log in and do everything through their phones. And then they also will keep a paper chart as well.
And what's the market like for it in America? Because over here, once upon a day there was like 2 different electronic care plan providers, and now there's like, I don't know, 30 that are on the market that you probably could go out and use. So what is the market for it? Is there just one that you all use, or is there a number out there available?
No, there's quite a few options to choose from, all the different price points, all with different options and offerings. The one we're with is we found to be just the best for us and very highly reputable. They lifetime training, they're available 24/7. Some others, because the company we had been with for since the beginning, they actually were getting bought out by a larger corporation. And so when we met with them, we just found that, they were increasing the price significantly because they, it's kind of, well, you're already in the system. You won't have to export everything. You won't have to do all this, tedious, laborious work to get your records and all of your data. So they figured people just, instead of dealing with the hassle, they'll just, raise the price dramatically. And that wasn't necessarily the case with us. So we started looking, and we found just a wonderful company, and they've been tremendous to work with. Their platform, I think, is even far superior to the other companies, and we've been very happy with it. And the staff enjoy it, and they find it very easy to work with. And so, but yeah, there are a number of different companies, and at least for our company, we get contacted maybe every couple of months by different companies wanting to poach us and get us to switch to them. And but we're very happy with the one we're with.
No, I was just going to ask a follow up quickly because the one thing we have around digital care provision in the UK is around data protection.
Mhm.
We have what's called GDPR. Please don't ask me to tell you what the acronym means. I want to ban
I won't.
acronyms. They're so hard to follow. But what are your rules around data sharing in data law? And is there any concerns around your digital use of data when it comes down to health and care records?
So again, that's where our state being non-licensed comes into effect. If when I was saying how we're not regulated, we have no oversight. Adam, you could very easily, create a domain, get a U.S. based phone number, and plant your flag in Michigan, and you could have a home care company here, and just hire people virtually, and you'd be you'd be all set. So there is no regulation over how we treat our data or anything. However, that's not now two separate things. I'm not talking about the home health care because that's fully regulated and monitored. We operate and protect our data. We have, all the HIPAA securities. HIPAA is you familiar with HIPAA? Okay, it's the Health Privacy Act. So we don't share data, we don't give information, and we have special encryption on our email system, everything. Same with our digital provider for charting and all of our staff. And that's the scary thing because there is no hard legalized oversight to home care in the state of Michigan. On our show a while back, we actually interviewed the president of the Home Care Association of America that represents the entire country for home care. And that was a big part of our discussion on how we're trying to get it's about half the country is non-licensed for home care. The other half is licensed. And that's always just amazed me and frightened me at the same time because anybody could say they're a home care company. Anybody could send any person into a home saying they're a home care worker or a care worker. And families don't know any better, and they shouldn't be expected to know better because they're putting their trust just like when you go to your doctor, you don't ask to see his medical license. He says he's a doctor, you believe he's a doctor. But he has oversight, so you have that also, but that's something we're really hoping to see change. But the trouble with it is it's kind of like this. If we're all in the same classroom with 27 other people and there's 30 of us in there, half of us have to eat lunch at 1 and the other half can eat lunch whenever we feel like it. How can the teacher teach a lesson at 2 o'clock in case the other half of the classes decide to take lunch at that time? So getting all 30 of us in that classroom to agree to one time and one rule could be a bit challenging. Now magnify that to, 20 some other states or whatever the number is, and getting everybody on the same page for the same regulations, same rules, same governing and everything, it's a bit challenging because you're going to have a lot of companies they don't want the regulation, not for a negative or a bad reason, but that just means more paperwork. That means more things you got to go through, more documentation, and you know I'm sure people wouldn't be eagerly, aggressively seeking to, get on board with getting everything regulated, which hopefully at some point we will see that. I think that will be a long, tedious process, but it is in the works. But it's just, it takes time.
I think there's pros and cons to regulation when you look at other countries and what they're doing versus kind of the UK, because our regulator, the price has gone up. It's a ridiculous price. So obviously then new care providers that want to come into the market can't afford the cost.
Right.
You've then got staffing issues. And I think there's a massive deficit in the amount of care that is needed here. And what we're actually seeing is care workers leaving their companies, going to start up on their own, not being registered, just delivering kind of care to their neighbours in their local village or their town. And yeah, there's just like this black hole. And I know in my village, there's a handful of care workers that walk around, delivering care, but they're definitely not regulated. They're just in kind of plain clothes. And yeah, I think there's pros and cons to each. I think I personally agree with regulation, but here in the UK, it's not fit for purpose. It definitely needs to be something that is changeable and adaptable and involves care providers so that it's fluid. But
Well, that's exactly basically what we face here. You could have a caregiver who decides, I'm just going to be my own care company, right? In fact, this person wasn't related to us or connected to us, but we know of a family who did that route. They hired who they thought was a home care company, and it was just two women that kind of partnered up, and they were taking care of this woman's family, and they stole some jewelry. I mean, just, they would just call off at the last minute or not call at all. And finally, the daughter had enough because her parents needed this care. And so they met with our company, and we said, well, what company are they? What's the name of their company? She goes, I don't really know. They just gave me their names. I said, well, that's probably not really a company then, but they were well within their rights to operate that way. You know, they, but the sad part is there's no recourse. They're not going to have, workman's compensation, which is a mandatory insurance that you have to put on your company for your staff. Because if they get hurt on the job, well, then workman's comp will pay for their care through the employer, or the vice versa. If that person hurts themselves and they're just by themselves, their own company, they're going to turn around and go after the family and say, well, I can't work now because I hurt myself taking care of your mom. Or they steal jewelry. The family probably isn't going to go through the hassle and doing a background check and drug screening and all these other things, because again, they're I call it almost blindly trusting, right? They just think, well, this person says they're a company, they said they're this, so they must be that. And that's the unfortunate part. There's so many risks and liabilities involved that families aren't really aware of it. They're just looking for the care and for what's best for their family member. And they just put that trust in that person. And I think that's why it's so crucial that there is more regulation to that, so that these people and these families are protected, and they're getting somebody in the home who actually knows how to do the job and knows what's required. And the employees protected and the families protected.
Absolutely. And I think it's the same over here. You've got these kind of cowboy care workers working, and it's not until they just drop the customer, or as in like just leave the package, not actually physically drop them, or they go on annual leave for 2 weeks and the person's got no care, that the family are like, oh, actually, what are we going to do? Because there's one person providing all this care. And then that's when they start looking at care companies. I think then they figure out that actually what they have had isn't legit. But I'm very conscious of time. Adam, any further questions from you that you can think of?
Yeah, I think just one more, really. And I think this is to all three of us. And it came to me when you were talking about the background checks and not doing the drug testing. Now, drug testing is not something that's common practice in the UK. And I think if we did introduce drug testing as a sort of condition of employment within the NHS and the social care thing, we would have a big crisis on our hands. Because if you watch TikToks, there's always these jokes about, I have one drink, oh, where's the bag? Let's get some coke in. And we do have this sort of drug not accepting culture, but we acknowledge it's there and it goes on, and we don't do anything about it because at the moment it's not like Scarface or Goodfellas. It happens and it is what it is. So with this, is there stuff we can learn from each other? Is there stuff that we can sit here as the UK and go, actually, innovation-wise, in America, they're doing this in social care, and this is fantastic. We should try and replicate this over in the UK. And vice versa, regulators aside and regulation aside, is there stuff that we're doing in the UK that you think the US should be going, this is really good, we should try and look at implementing that with ourselves?
Well, I know I can only speak for our company, of course, but I know with us, we do have a drug-free, alcohol-free work environment. And there's several reasons for that. One is your drive, if we were taking care of your mother, Adam, and that caregiver had been out drinking until 2, 3 in the morning, and she has to be at your mom's at 8 a.m. and she's using some recreational drug, or even abusing a prescription drug that wasn't prescribed to her or him, and they get in a car accident. There's going to be huge issues there, not only for the company's liability, but also for the safety of your mom. You want to know that that person is a sound, clear mind to be able to function and operate a motorized vehicle, and entrust the care of that person into their service for the day or whatever that shift would be. So that's just our policy. As far as what the UK is doing, I've commended you guys many times, and still will do so. I think, leading the charge to raise the awareness for the care workers and for the care home and the quality of care being provided in these care homes, they go hand in hand. If you're getting a high quality respect and the deservingly so recognition as a care worker, you're going to have more pride in your job. You're going to enjoy your job, and you're going to want to be at your job. And you're going to want to kind of live up to that label that's been put on you as, a very important key factor in the healthcare system or the care sector. If you're not recognized, if you're not appreciated, and you're not getting the credit you deserve or the wages that you deserve, but yet you're just going to the job because, well, I got rent due at the end of the month, how well do you think that person's going to perform their job? They're just going to go through the motions. They're going to be half there, half out, half in the door, half out the door. So, that's something we really try to practice with regularly recognizing our staff, doing regular appraisals of them, evaluations, and letting them know, you're a key part of this team. We can't do it without you, which is true. The staff, whether it's a care home in the UK or home care here in the States, without them, none of the other stuff exists. So they should be the face of that sector. And it's just really sad to really kind of step back and see, they don't get the credit they deserve outside of maybe from their employers or even the families that they're, working with. And the work you guys are doing, I think is just so vital and crucial. And I would love to see more of that going on here in the States. We need an Adam to go give a speech to our House of Lords, even though here it's not the House of Lords. And Mark to get his petition of, what was it, 500,000, Mark?
500,000, yeah.
Just leading the charge to put a big spotlight on these, important aspects of our aged care industry and sectors.
Oh, one quick question, Adam, or not question, one thing. When I compare America and listening to you, Lance, talking earlier, and also, I don't know if you've got it on Netflix over there. There's a documentary here on Netflix called Golden Age, which is around the Palace in Miami and what they're doing with social care. It's a really good watch if anybody hasn't watched it. But there's so much emphasis over there on social activities, so going to the cinema and going for meals and just living your best life. Whereas I think here, the way care is commissioned is just to meet their basic needs. And then anything kind of extra is slightly different for services with learning disabilities, but definitely the elderly care, it's just the basic needs. And all that kind of social living life just kind of falls by the wayside. And I definitely think when I compare it over to America, I'd love to bring some of that over. So actually people...
Absolutely. Yeah. I know when we meet with families for the first time, part of our intake is asking that person or their family, if that person's not able to, talk for themselves, is what made you? What were your hobbies? What were your interests? What do you enjoy? What do you like? Because we tell them it's not just about coming in and helping with the personal care, keeping them safe, making them a meal, helping with their medications, getting dressed and all of that. That's the important physical part and maybe the mental part, but your wholesome part, why do you enjoy what you do? What made you? And Adam beat me to it, but we want to keep, we want to keep that person engaged and as much as possible, let them continue living their life the way they enjoyed living it.
Absolutely. And I think we do ask those questions. It's whether we take it that step further and actually put it into practice. But
yeah, we actually had a lady that I can give you many examples, but I'll just give you one. She had very advanced dementia. She was an acute diabetic. And so, her vision was almost gone. She couldn't remember things. And when we were hired to help her, the daughter during our intake, she was telling us and our care managers that, her mom for, I don't know, like 30, 40 years had season tickets to her local symphony. And I mean, this is like, going to, a music hall, just beautiful and, professional, but she had to give them up. And, our care manager said, no, she doesn't. Keep the tickets, add a ticket for the staff. And this was, I think, one Friday a month or something. And so they were able to continue that tradition for her. And it made all the difference in that lady's world. It changed her dramatically because she went from thinking, I've had to give it all up. I can't even enjoy that anymore. Well, now she still had the ability to do it. And that just, that's the more holistic, full person approach more than just the hands-on care, you know.
Oh, go on, Adam.
No, I was just going to say, no, I think that's really, really great. And I think the one thing I would like from I want to call it a relationship, Lance, between the Caring View and All Home Care Matters is really maybe having a catch up a couple of times a year, and lessons learned from each other, and you coming over with some of your innovations and what you've been doing and what you've been up to. We can have a chat with you about what we're doing and what we've been up to, and let's do it on the show. And let's really share this information and share these treasures to improve care on both sides. And you never know. Mr. Biden might invite Mark and I over to come and have a conversation with him. I don't know what the situation's like with your presidency at the moment, but we're open to it. We're happy for that, aren't we, Mark?
Yeah, most definitely. I'd love it.
That'd be great, you guys. But like I said, anything we can do to work together and help support the tremendous work you guys are doing, we're more than happy to do so.
Perfect.
I just had an idea before we end this. I was thinking maybe you guys should send us some content and we could share it and tag you guys on it.
We definitely will. Look, Adam's holding off. Oh no, it's not. I thought it was his notebook. I was going to say I'll definitely go on Adam's list today. We will definitely definitely do that. We really appreciate.
That's just an inside joke for people that are wondering. So, all right. Well, you guys, it's been an honor. Thank you so much for having us and having me. And I look forward to working with you guys for the time to come. So, anything we can do, we're here for you.
Thank you very much, and thank you much for joining. So, from all of us here at the Caring View, thank you very much, Adam. I'll let you roll it out.
Thank you so much. So yeah, don't forget to subscribe to our YouTube channel, subscribe to our podcast, go check out our sponsors, carestockroom.com, and join us for next week when we will be live with the next episode of The Caring View. But until then, good night, God bless, and take care.
Good night.
Bye-bye, everyone.